Welcome to the Natural Balance Hoof Care Corner. Today we're going to be out in the field looking at a little cutting horse, an ex-cutting horse that's has become very seriously lame. And the little guy's only 8 years old, and he basically has, by first appearance, pretty nice looking feet. But the problem is, like so many of them, is that he has some subtle hoof distortions that have created some very serious problems for him. And we're going to go through this thing in a systematic way over the next couple of weeks and show you how we deal with these kind of problems and, of course, how to avoid them. So we're going to take a look at him now at a walk and just kind of give you an idea of where he's at right now and a little bit of history as we go along here. And at first glance, you say, well, he's doing pretty good. And in all, he's walking, he's landing fairly flat, a little bit heel first once in a while. And there's a little bit of difference in his hind feet, the way they engage the ground. At a walk, he doesn't seem to be too bad. Okay, now if we'll take him at a trot. Okay, now look at his back end. That's really a critical thing. You notice how everything is changing now that you add a little force to that. His back end gets very short, his front end gets very short, and is obviously very lame. Okay. Okay. Very noticeably lame, the right front. And I'll show you why that is in a minute. We do have some x-rays here. Okay, if you'll go the other direction, okay. Is it equally as bad or worse going this direction? So now we're going to go ahead and go to the x-ray and show you kind of why this is all happening. It's such a shame, a nice young horse like this with that kind of lameness. Okay, at a brief view of this foot, you look at it and you say, that's a mighty nice looking foot. Pastern appears to line up fairly well. It's a well-conformed foot, doesn't have any serious flares, at least from a brief observation. But and this is a confusing thing about a foot like this, is that it just appears as though there's nothing really wrong. So we're going to go to the bottom now and take a look there and see if we can detect any distortions from that point of view. Okay, we're just going to exfoliate a little bit here and take away some of the chunks. Now, granted, he's had these shoes on for some time, so part of this distortion has to be accounted for by the extra growth. So we're just, you see where the bars are kind of curled around here? That's an early sign of hoof distortion in the back part. Even though this is a relatively club foot, it still has gotten some curl to these bars and they're trying to get away. So we're going to scope this out just like we do with every foot and find the widest part. Get a little chalky, get rid of the chalkiness here, and you can see this extra height here that that has developed over the past couple of months or so. But I'm sure that the last time this horse was shod, there was an effort made to try to maintain pastern alignment, which is a good idea. But nevertheless, it's still allowed these heels to drift forward and at the same time somewhat push the front part of the foot forward as well. So we're going to draw a line through here and around this back part. It's a little hard to find the exact widest part because they're so straight along the sides. So we're going to use our guidelines that we typically use to determine that. Approximately an inch behind the apex of the frog. We're going to find the true apex here. And that's going to be our best guide to give us a reference from where the widest part is and also where the tip of P3 is. So we'll look at this again. About an inch back from the apex of the frog. Pretty much a thumb's width. And if you look over here, you'll see there's basically where that widest part is. And once you've drawn that line, it changes the whole picture. Make a mark here. This is where the heel ends. This is where the toe ends. You can see this huge distance out in front. And you'd have never guessed that by looking at this foot from the side, that there was that much actual distortion in the front. We have some radiographs that we'll look at in a minute here, and we'll see that same distortion on those radiographs. We'll find it, that the distance from that widest part forward is tremendous difference. Approximately an inch ahead of the apex is where the tip of P3 is. Actually, the P3 is right about there. Our breakover really would like to be right there. That would be the most efficient thing for this horse right here. So anyway, that's basically scoping this foot out, finding the waxy part here, the waxy spot there, finding the actual widest part. Now we can see why this horse has developed the problems that he has, simply because of the inability to see the coffin bone and its relationship to the hoof capsule clearly. We've just looked at the horse in the field, and as we noticed, we've mapped out his foot, and we've discovered that there's a huge amount of foot forward of the widest part. Now we're looking at the x-rays. Now this is an oblique view. Looking at it from a DP or dorsal palmar view, we didn't see any significant changes of arthritis in the joint. But if you look at this oblique view, you see a large mass of arthritic changes right here. There's a little on the ligament attachments there and there as well. So there's something that's happened here with this foot, and it's in the form of ring bone, and it's consistent with both the medial and the lateral aspect of the pastern joint. Really common finding with horses that have this type of hoof distortion, where the distance from the widest part of the foot forward is much greater than it is to the back. It's just too difficult for them to get over the front of their foot consistently. And this horse was in training as a youngster, as a cutting horse, and he was in deep going. So any amount of extra length on his toe from the widest part forward is going to create an even bigger force that's going to cause the potential for this type of a bone reaction. This is the other side. You see the similar changes taking place, and this is quite a large buildup. So there's some real serious problems. If you look at the plane of the bottom of the bone, it's pretty much flat to the ground. Even though that foot looks like it's in a pretty much upright position, the coffin bone is at a fairly flat plane to the ground. And so any amount of extra length forward, when, mind you, the toe is actually way out here off the screen, where in fact what it should be is right directly under or slightly forward of the tip of P3. So it appears as though there's almost 1.5 inches of extra length out here of leverage, which in turn is causing this kind of problem. So it's nice to have the x-rays. We've seen a tremendous lameness issue with this guy, and this hasn't started just in the last few months. This has been going on since he was a youngster. It's just now manifested simply because of this extra length out here in front. It's sort of helped exacerbate this problem.
That's all the time we have for this week. Please tune in over the next few weeks as we go over the tools and techniques used to help these types of horses become more comfortable and more sound. Thank you very much. To quickly recap from last week's show, this horse has high ring bone. We have mapped out the foot and found there is more mass ahead of the widest part of the foot than behind. We will now continue with preparing the foot for shoeing application. Okay, we found, you can see the differences between this chalky layer right here, and this is very important to exfoliate this foot correctly, otherwise you lose the opportunity to have proper references. You can see we're going to go ahead and peel some of this old stuff out of here. And I'm going to get over on this side here, and I found the little waxy spot right there. And I'm just going to move forward, and you see how it's changing right there. This is the live functional sole. We don't want to take any more than that. We just want to identify where that waxy surface is. I'm going to go all the way across the toe here and find that same structure. And because of that, I'll be able to use it as a reference. Still crumbly. It looks a little different. We're getting closer to that waxy surface. Now you can see it very clearly. So we're going to identify all these structures. Now the objective here is to find the place where P3 is. Again, as we mentioned earlier in our series, that the distance, this being a small foot, the distance is going to be slightly smaller, shorter from the apex of the frog forward to the tip of P3. We could x-ray it and find out for sure, but basically 3/4 of an inch is where that is probably where the tip of P3 is. And just 1/4 of an inch ahead of that is basically where the breakover point is going to be. Once this foot is properly exfoliated, you can feel two raised areas right here and here. And those are the two pillars that we use as a reference for where breakover is to occur. Now, in light of that, it would have been easier to establish breakover point farther back underneath of that foot and eliminate some of this distortion out in front. Before we start to trim this foot, I'm going to go ahead and continue mapping it out. And the thing that I'm going to do here is I'm going to draw a line right across this exfoliated area on the sole to ensure that I don't trim too close at the sole, over the sole area. I'm going to draw that line, and I'll make my trim cut above that line so that I can be assured that I'm not going to be too close there. The objective is to trim the heels down so there's approximately 1/8 of an inch or so of gap in here. I'll show you how that's done. At the line that I've drawn across the apex of the frog to ensure that I don't get too close over the toe, and I keep my sights set at this area here at the widest part of the foot to see that I got that 1/8 of an inch. And once I've reached that, I just continue cutting right straight on through that. I don't raise, don't leave any extra heel. I just keep it cut at exactly that same angle. Same is true on this side, and to ensure that this is a flat plane here, I leave the trailing portion of my nippers out of the cut right there. It's very important that this nipper stays out of the cut right there. If I put it there, I might as well start right here at the toe. So I want to leave this trailing portion of my nippers out of the cut. Just take my sights here at the widest part of the foot and go all the way back. Straight line from that point. What I'm going to wind up with is a frog that's now engaging the ground. I've got plenty of extra height right here. You can see that gap right through there. I've got about 1/4 of an inch, so I'm going to take a little bit more of that as I trim. What the purpose of this is to, by trimming the heels back with respect to the live sole, I'm going to increase the length of this back part of the foot. Now, the heels previously ended at this spot here. Trimming them the manner that I have increased this distance by as much as 1/2 an inch. So I've lengthened this distance here by almost 1/3 of what it was before. Now I have to deal with the front part. With cases of high ring bone, which is the arthritis that's developing in the pastern joint, the distal end of P1 and the proximal end of P2, it's typical that these horses like to have their angles very low, which is very confusing because the foot already appears at sometimes to be very long in the toe, and that's oftentimes Mother Nature. What it is Mother Nature adapting to this continual long lever arm out in front. So what we're doing is to test him to see how he is with this. We've trimmed approximately 1/2 an inch off of his heel, and we've left every bit of that toe. So the thing that is really helpful to do in helping with this is to just merely lift the other foot off the ground, and if he lifts it willingly, then there'll be a pretty good chance that he'll be comfortable with that lower angle. So I put the foot on the ground, and I'm just going to reach over here on this other side. Very easily, he accepts that very nicely. Okay, I'm going to trim the toe off, and then we'll do another examination to show you how potentially uncomfortable he'll be. Now I'm back to this trimming the toe portion of this. I'm going to use the same approach to trimming the front part as I did the back. The trailing part of my nippers is going to be left out of the cut, and I started at the same spot as I did when I went to the rear. So I trimmed this, start my cut. Again, keep in mind that I want to stay above the black line that I've drawn here, and to ensure that I'm not too close. And come out with the forward portion of the nippers out this way. So I'm going to take a little bit off of this. There's a little black line in here. I'll take some of that away. Clean up the foot just a little bit. And you notice the curl that was once in these bars has actually broken it right there and fractured it. So I'm going to tend to that by taking it down. You can see where the curl that was on this one had actually created a bruise right here in this area. This is right underneath of the navicular bone as well. All of this bruising that's taking place here is a result of these heels curling in, jamming into that widest part of the foot. And you can see the line that I've drawn across there to identify that part. And you can still see all of this bruising that's occurring here. Okay, I'm going to redraw my line. This is the widest part of the foot. And you can see it a little bit clearer there now. And I'm going to bring this heel down so that the distance underneath there is approximately 1/8 of an inch. Same is true on this side. And I want this distance to be equal on both sides. Now, being able to leave this has given me the opportunity to not have to rasp too close here. So I'm going to trim the front part down until I just touch that exfoliated part of the sole right there. A little bit of chalkiness there. I want to make sure these measurements are as accurate as I can get them. I want that distance to be the same on each side. Now we'll just kind of recap this just a little bit. There's the widest part of the foot. There's now where the heel has been trimmed to. This is the place where breakover is going to be. It's approximately an inch ahead. On a small foot like this, that's appropriate. And if you look at that distance now, it's approximately a rasp's width, and it's equal 50-50, where before, this is where the heels previously were. This distance was about 1.25 inches, and this distance out here was nearly 3 times that long. So just by simply trimming the foot, we've been able to bisect it around the widest part of the foot in a balanced form.
That's all the time we have for this week. Please join us next week as we continue discussing the application of a double nail pad system for high ring bone horses. Thank you very much. Welcome back to the Natural Balance Hoof Care Corner. If you remember from last week, we were able to prepare the foot in a manner to attain a 50-50 ratio around the widest part of the foot. This week, we will go through the steps we take in constructing a double nail pad system for high ring bone cases.
Okay. What we found to be very helpful in the situations like this was what we started using was just a temporary sort of a diagnostic tool as well as a treatment tool. And that's a combination of these two pads. This is a very hard, what we call a double nail pad, and this is a 3/8. We oftentimes use 2 of these thicknesses on larger horses, but on a small guy like this we'll use the second one, which will be, this one will cut to fit his foot. We'll nail that onto his foot using pressure material inside to maintain good hoof function, and then we'll cut this piece, which will be smaller, and it'll give him the opportunity to break over forwards, medially, and laterally, and also it won't stop his heels from engaging the ground too soon, meaning he'll be able to reach as far as he can without stopping and tipping his foot forward, because keep in mind that when we tipped his foot forward, he didn't like it. So we want to get as much stride out of this guy as we can so that he can be functional. So we don't want to limit that by having an extra length to that. And this has been a common mistake with a lot of ring bone treatments in the past, is they think, well, we'll put an egg bar shoe on him, which in fact exacerbates the problem because it stops the foot from landing before it gets to its full length of stride. So it's sort of a different approach to this, but it certainly has been helpful in many, many cases. So a lot of these horses actually go back to being used, and some of them even go back to being rope horses and a few other things. But we never give a real positive prognosis because we never know exactly how they're going to adjust to these to the arthritic growths, and or how quickly they're going to fuse. So we're going to go ahead and fit this to the foot, and I'll show you how we do that. What I'm going to do is I'm going to put this, the flat side of this pad goes next to his foot, and I'm going to set it at his heels here where I want it. If he had an underrun heel, I would set that from right to the very back part of the dimple in the central sulcus, and that's where I set all of these. If the heels was underrun, then that would stick some behind the heels. In this particular case, the heels end right across that same line. Now, to ensure that I'm going to have it placed there, take my marker, reach underneath, and go right around this foot like so. Okay, I've made a mark on the pad. I can then pull the foot forward. I don't have to determine whether I'm in the same spot back here because I made a mark up on the front there, so now I know my pad's in exactly the same spot. Okay, now I can just take my marker, draw a line around that, and I've got an imprint of his foot, right? Some of this you can cut out with your nippers if you like. If you have pad cutters, that's fine.
Bandsaw works great. Any way you can get, cut right on that line. Okay. And if it gets too thick, use a little saw. Okay, this is the foot side. The wall is approximately 1/4 of an inch thick. The line is outside of the wall, so we're going to come in a calculated amount, so it's approximately 3/8 of an inch in. Keep in mind, we know where the widest part of the foot is. The heel was placed very specifically. The toe was set at this outside edge. So we're going to start just behind the widest part of the foot, first hole, approximately 1 inch apart. We'll make as many holes as we need. There's 4. Approximately 3/8 of an inch. Now on a bigger foot, you may want to get inside just a little bit more. Keep in mind, there was the edge of his foot, so there's about 1/4 of an inch. There's going to be a little bit left around the edge, so we can make as many holes in this as we want. The fact is, once this is on, we can dress it a little bit as well. Usually, an 1/8 inch bit or slightly smaller is significant. And you can just drill your holes right through the Before we go away, we're gonna make a smaller piece that's gonna fit inside of this. Remember, we want to bring the breakover back as much as we need to. And the nice thing about this plastic material is we can rocker this, we can rasp it, and get the breakover back as far as we need to. We can roll these edges away as much as we need to, and we can also bring the back. And we can make all of these adjustments once these two pieces are on the foot and attached to each other. So this is the piece that we're going to attach to that one. So to get a pattern, we're going to make it smaller. We'll need to make this basically that size, but we're going to come in to this area, so that's about 1 inch all the way around. Okay, just make some marks around here. Same in the back. Okay, so we got a basic, now we just connect the dots. Okay, and we'll cut this out to that configuration. Let me just shape this up a little bit, see how it fits. Inside, need to rasp a little bit right here, and then it'll fit pretty good. All right. Now we're going to pre-drill some holes in this. We have to get some screws. Drywall screws are usually all right. Deck screws that have a Teflon coating are much better. They don't tend to rot away over the period of time. We've got horses that are in these things and have been in them for years. They actually get along very well with this and actually become very functional. Where in the past, ring bone has been a very guarded prognosis for any type of athletic ability. Doesn't mean that these horses are going to be world's champions, but they certainly can be functional. And once that leg fuses, there's a chances of the pain is going to be completely gone. And if that's the case, then there's a pretty good chance that he can be very usable. He's a very young horse, and he deserves the right to live a fairly happy life if we can get him that way. I put plenty of screws in here because there is a failure factor with drywall screws especially. So I usually countersink these just because okay.
That's all the time we have for this week. Please join us next week when we go through the steps in attaching the double nail pad to the foot. Thank you. Welcome back to the Natural Balance Hoof Care Corner. We'll go ahead and apply the double nail pad system that we constructed during last week's show.
Before we put this on, to ensure that we get it placed under his foot in the best possible way, we're going to take away some of the flares and eliminate as much of that as possible. There's just a slight ridge right here, and everything below that is just slightly flared. So we're going to groom that just a little bit. Okay, doesn't take a whole lot. Okay, we're going to put impression material in this guy, so before we do that, we're going to clean the foot out real good along the commissures here to get rid of any manure or anything like that we might have missed in the first cleaning. Before I'm going to use a little magic cushion. This is a new compound that's out. I'm going to put just a little bit of it down in the commissures, and it just helps to keep a better environment underneath there. The impression material tends to hydrate the foot, and it can be used several times without it, but we've got where we use more and more of it as we go along, just to treat the foot prophylactically to help keep the environment proper. I'm going to select a portion of this that's approximately half the amount that I'm going to use, and that's approximately what I'm going to use. I'll add the other composite to this and then mix them together. Take just a very small portion of this, and it doesn't take very much. It's just a smitten, and then put it right down in there, and just a slight covering of that is usually enough to maintain good environment inside of this, underneath of this impression material. A little bit right down in that section be helpful. To ensure that we have make a perfect mold of the bottom of the foot, we use an impression pad, a real hard, very flat deal. We put some tape on it to help hold it in place, so we can take some other wraps over the top of that. To make sure that we get that done correctly, we'll unroll a little bit of this tape and then re-roll it. Some horses are a little bit frightened of that tape ripping off of there, so we always try to prepare the tape that way. Take this amount that we've checked, we duplicate it with the colored compound. This is the soft material. We have three types, pink, blue. Pink is the normal, is the medium, blue is the soft, and yellow is the firm. And we overlap these materials like this, and just keep overlapping them. They blend together, and when they finally get blended completely, then we'll put that in the foot, tape this pad on, wrap it around with that, and I'll show you how to do that. Try to get as much of the colors blended as you can. It's very important. Okay, take the pad, the duct tape, and go to the horse. Place the material in, smash it down. We're going to fill the whole bottom of this foot. And usually when I trim the frog away, I've left areas back here so that in case there's an abundance, it can be spread right out through the back and smashed out that way. Place it on his foot, pull the tabs down. That holds the pad in place. Take the tape, secure one side, and just merely wrap it around. You want to take one good wrap up over the heels to ensure that it stays in place in case he twists or turns on it. And this is just a temporary application until that material sets up. It takes approximately 2 minutes for that to happen. Reach over and pull this foot up off the ground so it makes a good solid, good compression in there. We don't have any x-rays on this foot here, and we certainly need to kind of get some information about this. So we've trimmed his foot just like we have the other side. So we'll just use our field test to sort of determine some things. And if we suspect that he's got some changes taking place in this foot, we may suggest that he get this one radiographed as well. Nevertheless, we're going to treat it probably the same based on the testing that we're going to do here, because we found it consistent over there. And so we're going to do the same thing on this side. So we'll put this Put something under his toe. Okay. Okay. So he really hasn't moved his foot from that position. At least he hasn't snapped it away. So we feel like there's something going on. So this would warrant probably some further investigation if you ever wanted to really check it out. So we're going to put a deal on him just like the other side, just to somewhat balance him out. But also we see like there's some significance to that. And I think we're going to treat him the same. And if he does well, fine. If he doesn't, then we can always go from there. Very seldom you ever run into one that's got a high ring bone in one foot and low ring bone in the other, meaning they'd have to be treated differently. So we'll do the same with this one. We use a little different type nail when we nail these on. Use an E-head nail. It's got a good large head on it, and that sets into this very nicely. We don't countersink these. We just drive them in good, deep and hard, and they, believe it or not, they stay real good. These things will stay on for 2 or 3 months without any trouble if you thought they needed to be that long. There's usually a little bit of this that will spill out through the back, and that's set up. I can feel it through that. So now I can go ahead and take this wrapping off here. You can see that little bit that's spilled out the back, and the solution that we put in there, you can see it kind of leaking out the back, which is good, meaning it's filled the whole underneath side of the foot, and it's made a nice firm structure in there for treating navicular disease. This is the best thing we've found so far, because it'll help maintain good circulation. It'll help that frog become real big and functional, and so we're treating not only the navicular with this as well as the ring bone. Nice thick walls. Take a good look at those so you know that it's a little difficult for the first time you do this. Sometimes it seems a bit scary the first time you do this because you're not accustomed to not being able to see where you're nailing, so make sure everything is back where you want it to begin with, because your nails are all drilled to accommodate. 3 nails in this guy will probably be about right. So nice. You want to drive those nails down to their flush with this surface here. Best to use a nice solid block underneath. Most horses will not object to that. Now, we still have our centerpiece to put on here, and I suggest that you put this piece on first, the other one later, simply because now you can clinch that. If you had attached that piece on first, then you wouldn't get a good clinch on this thing. So we'll go ahead and clinch it up now and get it ready for the next part.
That's all the time we have for this week. Join us next week as we put the finishing touches on this double nail pad system. We'll do some road testing and see if we accomplished our goals of making this guy a little more comfortable. Welcome back to the Natural Balance Hoof Care Corner. We'll go ahead and put the finishing touches on this double nail pad system.
Ready? As a rule, I'll cut these just a little bit longer than I would normally with a shoe. Just because sometimes you can't really feel that nail head, and so you want to be able to get it to turn before you press down on it. You don't want to be pushing it back out. Finish it off in a proper way. It's always nice to have it just a little bit wider. You can always shape this around the back here once you get it on. Make it fit up just nicely. Okay? Something like that. This is a real important phase of this here. Especially the thing that you don't want to have happen is to end up with a screw that goes clear through that pad that we've just put on him.
in an effort to get this one attached. So that one is a ½ inch thick, so you want to be sure and check, make sure that you have the proper screws. And you see that's not quite a ½ inch. And it's not going to be a lot of screw. That's why we've put plenty of holes here. So I've countersunk these to accommodate a 3/4 inch screw. And if you have a thicker piece here, then you can use a 1 inch screw. So it's very important to consider that when you start to attach this piece onto that one. So we'll set all these screws in here first, take it to the foot, and then we'll put, actually it's best if you put 2 or 3 screws in, and then we'll road test him, and then if we have to adjust this, we can move it backwards, we can move it sideways, we can move it forwards if we need to accommodate fine-tuning around that coffin joint. So we'll put screw there, one there, and all 4 corners, and then test him, and then we'll put the rest of the screws in once we get this finally placed. Okay, it's important to get this piece centered around the center of articulation. Now, systematically, when we drew our lines on here, remember we had approximately an inch back from the apex of the frog. That was where our breakover wanted to be, and the widest part of this pad formation is basically where the widest part of the foot is, and it's also the center of articulation. So, with that in mind, we can bisect this piece equally, place it in that perspective right there, and be pretty darn close. The nice thing about this material is we're going to be able to rasp away this material here. We're going to be able to rasp away the back part to bring these ratios in together. And so for a diagnostic purpose as well as a treatment protocol, this works real well. To ensure that we don't get, though we can rasp that front back, I'm going to go ahead and start my screws, these 2 screws here and those right there. And then we can make some adjustments by filing this away. Get it centered as close as you can, medially and laterally. And just bring those down snug. Try not to spin them in that bottom piece. Okay, we're back here. We've got him shod. We did make some changes on his back feet. We put a front shoe actually on his hind foot, which allowed us to bring it back a lot farther. And if you notice how much more farther he reaches behind, he's actually got a very nice heel first landing and much longer stride. Same in the front, and we can make some adjustments with the rasp here to kind of help him with that a little bit, and we'll just see how he's going. So far he seems to be more willing to move, and his trot is almost without a head bob. His stride isn't extremely long, but he's landing nice and flat, and he's not jabbing his toes in the ground behind. And he's certainly more willing to go. He's actually wanting to get on pasture. So there's a strong improvement. A lot of it is how they engage the ground. He's able to, without any restrictions on his heels, he's able to move real good. I'm going to make some adjustments on the pad just a little bit to see if I can get him to extend his stride just a little bit more. What inevitably is going to happen here is he's going to start wearing the front of this off a lot. As you can see there, it's already scuffed up. And so just to see the effects of that, I'm going to roll this back just a little bit more, just to see if I can't help him get just a little more sound right away. So I'm just going to rocker both of these right back into, so I brought his breakover back a good ½ to 3/4 of an inch here. I can rocker the sides if I want to, but those things will wear out on their own over a period of time. Also, to increase his length of stride, I'm going to rasp this heel back here a little bit too. That way, remember, when we did our diagnostic work, he didn't like to be elevated. So any amount of articulation in as far as a forward position of his foot is not going to be desirable. So to get him to reach farther, I'm going to roll the back part. What we're doing is we're just narrowing the surfaces around the articulation of this joint. And remember, we've got this placed in the center. We're moving both forces back, and we'll just see how he likes that. I'll do the same on the other side. Okay, we got a very nice heel first landing. He's reaching just a little bit farther with each stride. Notice the difference between our first, where he was real short and choppy. By rasping that little bit off the heel, he was able to get his foot farther forward and reach just a little farther with no articulation in the joint, which is really important. So he's going to become more active simply because we've offered him an opportunity to reduce the forces around that arthritic growth. Okay, got a very nice, very little head bob there, very little. Nice long stride. Notice the hind feet, they're not sticking in the ground. His stride has gotten longer, both front and back, just because we've been able to help him with the front ones and allow them to get farther, so his back ones now have the opportunity to go farther as well. Okay, great. A little cautious turning the corner, but keep in mind he's on a real hard surface here. This is a real hard packed road base, might as well be concrete. And you don't see a whole lot of, I mean, other than just holding back a little bit, he doesn't have any real serious discomfort like he did to begin with. Okay, now the other way. Okay, now in an arena surface and the soft going, he's going to do a lot better, probably 20% better than he is, and probably can go back to some kind of use. The thing about these ring bone horses is the objective, particularly at a young horse like this, is to allow that joint to fuse. And once it fuses, then he's going to be able to he won't have any pain at all. So the objective is to keep him moving, keep him active, but make him as comfortable as you can throughout that period of time. And with the hopes and long-term future is to get him to fuse that joint, and then he'll be wearing his foot naturally, very much like this, and he should be, with the hopes of getting it fused, he should be able to resume some sort of normal function, and even a pretty high level competition in some cases. So there is hope for these guys. As much as you might think it's a devastating thing, there's still a lot of hope for them. If we just kind of understand some of the mechanics and can employ some of these basic principles that we learned from the wild horses. So with that, we'll get on to the next project. So, all right.